COVID-19 update. We'll get things started right away with our update on our statistics here in Dominica, and that, as always, is being presented by Dr. Shaluddin Ahmed.
Minister for Health, Wellness and New Health Investment, Honorable Dr. Arvind McIntyre, Permanent Secretary for Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-White, Chief Medical Officer, Dr. David Johnson, our Acting Deputy Chief of Police, Davidson Valerie, and our very best Communication Officer, Ms. Sheena Harry. Good evening to all. Since the last press briefing, we have 5 new confirmed cases of COVID-19. During this period, we have discharged 6 individuals from our COVID center. So the total active cases are 27 now. 4 of the last 5 COVID cases are imported ones, and 1 is a contact of an imported case. They are between the age of 20 to 56 years old, 3 females and 2 males. All 5 cases are asymptomatic and they do not have any chronic medical conditions. The contact tracing is ongoing. So far, all except 1 is negative. In summary, our active cases are 27 and the total number of cases 68. We have completed community screening for the remainder of the health districts. These include St. Joseph, Portsmouth, La Plaine, and Grand Bay health districts. A total of 80 rapid tests were conducted with a response rate of 100%. There were randomly selected individuals from the catchment area. All participants were very cooperative. Out of these 80 tests, only 2 individuals were reactive to the test. Subsequently, both of these individuals were tested negative using the PCR method. Thanks to our district medical team for their tireless effort in completing this screening process. We plan to conduct more community testing in hot zone area and before the upcoming holidays. The Ministry of Health takes this opportunity to once again emphasize the importance of wearing of a mask when you are in public space, frequent hand washing or the use of alcohol-based hand sanitizer, maintain a 6 feet physical distance from others, and avoid contact with people who are experiencing respiratory symptoms. With this, I thank you and have a good evening.
And our thanks to Dr. Ahmed for his continued surveillance of the COVID-19 situation here in Dominica. And as he said, we now have 27 active COVID-19 cases on island. And as we continue to monitor what happens across the world, although it may appear that our recovery rate is excellent in Dominica, that is no call for us to become complacent. Next up this evening, we welcome with us the Acting Deputy Chief of Police, Davidson Valerie.
Minister of Health, Wellness and New Health Investment, Dr. the Honorable Arvind McIntyre. PS, in the Ministry of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-White. CM, Dr. David Johnson, Dr. Ahmed, members of the listening public, ladies and gentlemen, good evening. The pleasure is mine today to provide you with the information on the legislation regarding the mandatory wearing of masks, large gatherings, and other gatherings. Section 3 of the Peace Preservation Act, Chapter 1504 of the Laws of the Commonwealth of Dominica, makes it an offense for anyone to wear a mask in public. However, the government of the Commonwealth of Dominica has found it necessary to effect new legislations for the strict adherence by everyone to prevent the further spread of COVID-19. Therefore, the Peace Preservation Act was amended to allow for individuals to wear masks in keeping with the regulations made under the Environmental Health Services Act, number 8 of 1997. The Environmental Health Services COVID-19 Amendment Regulations 2020 has made it mandatory that everyone wears a mask or suitable covering over the nose and mouth. Everyone will be required to use a mask while one using a motor omnibus, hiring car or taxi, or any public transportation. 2, in public buildings, including supermarkets, retail and wholesale commercial establishments. 3, at a bar, a market, or other similar business or place. 4, other public spaces, including parks, riverbanks, and beaches. A police officer or the owner of a premise that a person has entered or is seeking to enter may request anyone to remove or adjust his mask or suitable covering for identification purposes. Anyone who offers for hire a motor omnibus, hiring car or taxi, or any other public transportation and does not require the passengers to wear a mask or suitable covering over his nose and mouth commits an offense. Or any bus or establishment that does not require a person accessing the bus or business to wear a mask or suitable covering over the nose and mouth commits an offense. Large gathering. No person shall host a gathering of more than 50 persons unless the persons have a written permission of the Chief of Police. An applicant requesting permission to host an event must ensure that all the necessary information are captured on the event application form. The applicant must ensure that his name, home address, telephone number or numbers, and any other information as may be requested by the Chief of Police are documented. Application forms are available at Discover Dominica authorities. On receipt of the prescribed application form, a monitoring and approval team comprising personnel of the Dominica Police Force and the Ministry of Health will inspect each venue prior to approval. Let me bring to your attention that anyone found in breach of the regulations pertaining to large and other gatherings commit an offense under Section 21 of the Environmental Health Services Act, number 8 of 1997, and is liable on summary conviction to a fine of $10,000 or 1 year imprisonment. Anyone found wearing a mask, anyone found not wearing a mask in compliance with the regulations commits an offense, and on summary conviction to a fine of $75. I want to reiterate that these measures are not meant to be punitive, but to persuade everyone to comply with the requirements so as to minimize the spread of COVID-19. I can report that 21 applications were received during the independent season. However, following the recommendation of the Honorable Minister of Health, all events were postponed or cancelled. Finally, it would be remiss of me not to express our sincere thanks to the general public and event organizers for their cooperation and support thus far. Thank you.
And thank you very much to the Acting Deputy Chief of Police, Davidson Valerie, and of course to the entire police force. With these changes, we understand that your task has grown exponentially. You have our full support, and we ask that the general public show their support and cooperation as well. And finally, this evening, we welcome to the podium the Chief Medical Officer, Dr. David Johnson.
Thank you very much, Ms. Harry. The Honorable Minister for Health, Wellness, and New Health Investment, the Honorable Dr. Irvin McIntyre, our Permanent Secretary in the Ministry of Health, Mrs. Letitia Lestrade-White, our Acting Deputy Chief of Police, Davidson Valerie, Dr. Ahmed, our Acting National Epidemiologist, to you, the viewing and listening audience, good evening. Dominica's result in the war against COVID-19 speak for themselves, and our commitment in fighting this invisible enemy remains strong. None of us know for sure how long the COVID-19 pandemic will last. However, we do know that it is a marathon. We do not have all of the vast resources which some of the very rich countries have at their disposal. What we have is an unwavering commitment and teamwork and resilience to prevent COVID-19 pandemic from destroying our nature isle. What we have for effective response to this invisible enemy, which is taking a toll on every single country, is leadership, commitment, and a strong public health system. A system that is rooted in collaboration, evidence-informed decision-making, and very importantly, ethical decision-making. These are some of the fundamental principles guiding principles for which we hold dearly and for which we are proud and to which other countries in the international community look up to Dominica too. We recognize that our areas of strategy in finding every case, isolating every case, treat every case, and to aggressively track down and quarantine every contact that we have to consistently improve on. I should let you know that we listen to the positive criticisms to those who have a genuine interest in ensuring that we win the war against COVID-19 disease. However, let me remind all of us, as I often do every time I get the opportunity to do so, do not circulate negative things on social media, since it is of no good to anyone. Every country is grappling with this pandemic, which is taking a toll on our frontline workers. The state is in fact putting huge amount of resources to fight COVID-19 disease. We would certainly wish to offer 5-star accommodation at the quarantine facilities. But the truth is, it is not even the richest countries in the world can afford to do so. Quarantine sites require a significant amount of human and financial resources to run. Of course, our clients have varying needs, and we are continuously seeking to communicate better to travelers entering Dominica so they can plan better ahead of their arrival in Dominica. Dominica's risk communication strategy is based on full transparency and openness to the general public with regards to the COVID-19 pandemic and all other public health threats. But we recognize that we have to intensify the public education with regards to COVID-19. Yes, washing hands with soap and water for 20 seconds or using 70% alcohol hand sanitizer, social distancing, as we continue to say, and wearing of masks and cough etiquette may sound simple, but these have proven to work. Do not get tired of practicing these simple things. Do not get tired of practicing these simple things. The evidence has shown that countries which practice these simple things are the ones with the best results against COVID-19. But don't get me wrong, the state has invested a huge amount of resources to procure equipment, medical and laboratory supplies to manage COVID-19 disease. Our approach is to prevent persons from becoming infected with the disease and ensuring that we have all the necessary resources to manage those who get sick. I want to commend the Honorable Minister for Health and indeed the entire cabinet for taking a bold step in tightening up the legislation and regulations in the fight against COVID-19. The Environment Health Services Act, indeed the Communicable and Notifiable Disease Regulation, which is SRO 57 of 2030, was amended, as you've heard, in March 2020 to include COVID-19 disease as a communicable notifiable disease. The prevention and control of COVID-19 in Dominica is further regulated, as you have heard, under the statutory rules of Regulation number 26 of 2020. Last Friday, and indeed just moments ago, you've heard from the Deputy Chief of Police the details in the amendments. As Chief Medical Officer, I welcome the amendments to these regulations. The wearing of masks or suitable covering over one's nose and mouth in public places is absolutely critical as a public health measure in the fight against COVID-19. The evidence is clear. The countries where mask wearing is in public is mandatory are doing better than those who don't. But it's not just wearing masks. For it to be effective, you must wear it properly. Do not touch, let me say this again, do not touch the inside portion of the mask with your dirty hands. When you go to put on your mask, make sure your hands are clean. Obviously, it is best it is best to wash your hands with soap and water, or clean your hands with hand sanitizer, 70% alcohol, hand sanitizer, when you go to put on your mask. In walking around the city and other parts of Dominica, I want to say something on the wrong use of the mask. Do not wear the mask around your neck. Do not wear the mask around your forehead or under your nose or just under your chin. Your mask should be worn to cover both your mouth and your nose at the same time. By now, everyone who accepts science of how the COVID virus is spread knows that the chances of the disease spreading is higher in mass gathering. Clearly, the more people that are gathered in one place, the greater the chances of the disease will spread if a person in the gathering is infected with the virus. The state has taken the right public health intervention, which will soon come into effect, to limit mass gathering in Dominica to nothing greater than 200 persons. For now, as you have heard, schools and religious institutions are not included. However, let me just say this to the schools and religious institutions. Schools and religious institutions must continue to adhere to the established health protocols of physical distancing, wearing of masks, and ensuring that there is adequate means for hand sanitization in those institutions. We just cannot afford to drop the ball at our churches and schools. Let me inform you that before COVID-19, the laws of Dominica impose, as you have heard, penalties for persons who are in breach of measures put in place to protect public health. As of Monday, November 9th, 2020, we have, as you have heard, completed our random community screening in all of our health districts around Dominica. This was done so as to give us a sense as to what is happening in the community. And therefore, I'm happy to report that based on the data that we have gathered, we have found no evidence so far of community transmission of COVID-19 in Dominica. I'm confident that the majority of us in Dominica understand and appreciate the measures put in place to control the pandemic. These are necessary actions. It is the right thing to do. We owe it to ourselves, we owe it to our loved ones, we owe it to our beloved country. We are all in this thing together. Clearly, the state, and I want to repeat this, clearly, the state cannot legislate everything that we have to do to control COVID-19. The state cannot legislate everything that we have to do. The state cannot legislate all our behaviors. Our behavior matter. We must act responsibly. The war against this pandemic is far, far from over. Last week, November 6th, the Pan American Health Organization had a virtual meeting of ministers of health in the region, for which I was pleased to attend with the Honorable Minister. And the access to getting the vaccine for COVID was the main item discussed. And therefore, Dominica wishes to extend its profound gratitude to the Pan American Health Organization and indeed the Caribbean Public Health Agency for the support in ensuring that small island developing states like Dominica will be able to procure the vaccine when it becomes available. I know that our frontline workers feel tired and exhausted, and more is being asked of you each and every day. Whenever you start to list persons or institutions, I'm aware that you run the risk of leaving out someone. But to all of our health workers within the health districts and at the Dominica China Friendship Hospital, our health promotion coordinator and staff of the health promotion unit, our dedicated staff at the Dominica National Laboratory located at the Dominica China Friendship Hospital, our supplies manager at the Central Medical Store, to our fire and ambulance officers, our police, the CEO of DASPA, Dominica Air and Seaport Authority, and staff, and so many others and institutions who are in the army in this war in saving Dominica from the ravages of COVID-19, we say a heartfelt thank you, and may God richly bless you. Let us continue to fight COVID. I thank you very much for your attention.
And our thanks to the Chief Medical Officer, Dr. David Johnson. And of course, on behalf of all the staff of the Ministry of Health, Wellness and New Health Investment, would like to thank those at the helm, including CMO, the Minister, and the Permanent Secretary, of course, for their leadership and their guidance as we all battle this pandemic. Thank you so much. Ladies and gentlemen, again, 5 new cases here in Dominica, 27 active. However, no deaths at this point in Dominica. And that is largely due to the tireless efforts of everyone that the Chief Medical Officer has mentioned, and of course, you, the general public. We continue to plead with you, to urge you to adhere to these protocols. Masks in public, mandatory. For those of you who wish to make payments, that is now made a lot easier for you if you need a test, PCR test done, or if you need to pay for quarantine. You may do so by visiting epayment.dominica.gov.dm. That's epayment.dominica.gov.dm. Of course, all the protocols, updated protocols, can be found at dominica.gov.dm. We thank you for your attention. Thank you to our media partners for making this possible. And we continue to ask you to protect yourselves and your loved ones. Remember that your health is your responsibility. Good evening.